Welcome to the Guy's Guide to Health. I'm your host, James Lesh. On the Guy's Guide to Health, we talk to experts across all different fields of health, including nutrition, fitness, sleep, psychology, medicine, and more to uncover the insights and tools that you can use to live your healthiest life as a modern man. Today, we talk to Dr. Alexandra Kreps, an internal medicine doctor and startup advisor, about her experience working in medicine, how healthcare consumption differs between men and women, her experience working in health tech startups, and how she views startups as part of the healthcare landscape, and more. Now, onto the show. So we're live here with Alexandra Kreps. I'm James Lesh. I'm the host of this is the Men's Health Unlocked podcast. At least that's what we're calling it right now. This is the first episode, so that's probably liable to change. But just to give a quick overview of this podcast is all about all things men's health, but also general wellness. We're going to be talking to a lot of different experts in the healthcare space. And just in the kind of health and wellness space in general. And today we have our first guest, Dr. Alexandra Kreps.
Hi,
Awesome. Thanks for
I'm
joining
excited
us.
to be
So
here.
yeah. So a little bit more background on this podcast. So this podcast, I am also the founder of a company called Vital Protocol, which is a men's telehealth company. And Alexandra, you are obviously involved in that company as a physician advisor. But I also just thought you'd be a great first guest to have on the show. And we have a bunch of different topics we're going to be covering today. But I thought we could just start by you giving us just a quick overview of your background, what you're up to, and kind of what got you into medicine.
Sure. So I'm a native New Yorker. I've been here most of my life, I would say. I'm an internal medicine physician and I practice primarily primary care, outpatient medicine. Um, I did most of my training for medical school and residency in Brooklyn, and have been here ever since. Mostly worked in Manhattan, though. I have a deep interest in health tech and healthcare innovation in general, and have been a physician advisor and consultant for several health tech companies. And I'm looking forward to speaking more today about the state of wellness and, all things medicine.
Awesome. Yeah, we'll get into some of your experience in health tech. I think it's very interesting. But first, I kind of wanted to just go over more of your medical background. And I believe, you're an internist. I would love to just know more about what an internist does, what kind of conditions you see, what kind of patients you see. Prior to Vital Protocol or working in business and tech, I was a CNA when I was in college. So have experience working around doctors and being in the healthcare system, and it's something I still keep an eye on. I'm always interested in, so I would just love to hear more about your experience as an internist.
Sure. And I don't know if I answered your question before, but what really got me into medicine initially was, I loved science. I loved the objectivity of science. But I was also an artist as a child. And as a teenager, I was very involved in art and loved that medicine sort of blends art and science together in a very unique way. And so that was really how my interest in medicine began. And the human body is really the most fascinating machine of them all. Um, so after, during medical school, you apply for your residency, your specialty of choice, and then you do your training and residency. Um, the reason I chose internal medicine was because I really wanted to garner a really broad knowledge of medicine. I wanted to be able to have touched upon all organ systems and have sort of a much deeper understanding of the human body as a whole, which internal medicine really affords more so than other specialties where you sort of start honing in on maybe one system, one part of the body. So another way of looking at an internist, they're really like a detective. They're looking at mystery diagnosis. They're the Dr. House, of medicine. Dr. House was an infectious disease doctor as well, but he was, at his core, an internist. And internal medicine is really the study of adult medicine. So 18 and over is what I can see. And we really cover all aspects of medicine from primary care to hospital medicine and intensive care. Um, Internal medicine physicians are the only physicians that are able to specialize in several fields like cardiology, nephrology, infectious disease, pulmonary critical care, hematology, oncology. Um, There's some overlap with family medicine. They're also able to do other specialties like geriatrics, which we can also do, sports medicine. But we have broader opportunity in terms of what we can specialize post our general residency or 3-year general residency. So that's sort of where they differ. But in the primary care setting, you'll see family medicine physicians and internal medicine physician um, trained professionals. Um, Tell me more, is there anything specific you were
No,
curious
yeah,
about
no,
internal
that was a
medicine?
great overview. Yeah, I don't think I ever understood what the difference was, or if there even was a difference between family medicine, primary care, or an internist. I always heard internist, and it's easy to hear that, and actually my mind would go to like intern and think like a resident doctor, and then I'd hear the ist part of it and be like, okay, never mind, it's that's a type of doctor, but I was never 100% sure. So an internist is very much like a generalist in medicine and kind of helps triage, I imagine, a lot of these cases and then send them off to the requisite specialists for whatever kind of comes up if it gets to that point.
Yeah, a lot of people like to consider the primary care physician as sort of the quarterback of your health, sort of that leader taking charge of helping you navigate the healthcare system as a whole, which can be very difficult and daunting. Even as a doctor, it can be very difficult and daunting. So, we're typically the first line of defense in terms of patients coming in with several symptoms, with an unknown cause, and helping them sort of get to a diagnosis or get to the right specialist for the official diagnosis. Starting an initial workup, though, and sometimes diagnosing ourselves, of course, and treating. Um, so, we are often the people come to with, several symptoms, some that feel connected, some maybe not so much. Sometimes it can be one issue, sometimes it's two at the same time. So we're really there to help them sort it out and sort of navigate their healthcare journey and whatever issue they're dealing with. And then we also provide other things like annual physicals, which are typically done when someone is in a generally good state of health and just wants to check, various labs and go through all the, annual screenings that are necessary. Typically, those are cancer screenings, mammograms, prostate cancer screenings, which is a blood test, those types of various issues. Those start to sort of stack up as you get older as well. When you're in
Hmm.
your 20s, 30s, there aren't as many screenings.
Right. And did you typically work in a mostly a hospital setting, or is it a mix of outpatient and inpatient?
Well, as an internal medicine physician, you can do primary care. You can also do hospitalist medicine. Nowadays, it used to be, 10, 20 years ago, the primary care physician might manage their patients and their panel, even if they're admitted to the hospital. So they might do a clinic in the morning and then round on their hospital patients. Now, most physicians are hired physicians, and they're either working strictly in the hospital or strictly outpatient. I essentially did about 90% outpatient.
Hmm, okay.
But for most of my career post residency, it was with an academic medical center that had several hospitals around New York City. So I was able to admit patients, directly from the clinic if needed.
Gotcha. Yeah, I was curious because I was wondering, are these when you're seeing, obviously, if you're seeing a patient or if you're doing most of your work in a hospital, it's probably more of I would imagine, a short-term relationship with each patient versus how does that differ? Do you have more of a long-term ongoing relationship with these patients when you're seeing them outpatient, kind of tracking their health over a long period of time, or is it similar to the hospital in that you kind of only see these people every now and again?
Yeah, so there's a crude word for what we call patients that come into the hospital very often, which is frequent flyer. So those
Hmm.
are patients that you'll see over and over go in the hospital. But typically, hospitalists don't see the same patients and don't garner that relationship with patients. Or unfortunately, if you are coming to the hospital very often, maybe you do have the same hospitalist, but that's not necessarily going to be the case. Primary care um, is really meant to have that long-term relationship over many, many years. Patients can follow with physicians for 20, 30, 40 years if
Hmm.
the physician's practicing that long. So, we really enjoy that aspect of medicine and healthcare is that human connection. And I think one of the deepest ones you make is with your primary care physician.
Right. Yeah, frequent flyers. That was an interesting thing that I learned when I worked in the hospital. Because it's like, if you're familiar with, I'm sure, in all these other areas of life, there's the power law where, you've got 20% of the inputs create 80% of the outputs. And it's true in the healthcare system as well. I worked in an emergency department, and, you would see when patients would come in, you'd have to enter their vitals into the medical record, and you'd see their history of recent admissions, and there was a lot of the people who you would see were just in a week ago or 2 weeks ago, and then just going back weeks and weeks after that. A lot of the same repeat people, which is interesting. But anyway, so obviously this, like I said, mostly a men's health focused podcast, and obviously you kind of see a range of patients. So I want to ask you kind of what do you typically see, or what kind of conditions do a lot of men present, that you've seen? What are kind of common men's health issues that you see out there?
Sure. Yeah. So men have the same issues as women. They come in with cardiovascular issues, chest pain, GI issues. They have sinus infections, headaches, migraines, COVID, flu, all the overlapping symptoms with anyone else. But men definitely have their own unique set of issues and complaints. We see a lot of men wanting STD testing, fertility testing, definitely a growing demand for testing of male hormones like testosterone. So overall, that's definitely become a larger part of the practice outside from the quote unquote normal issues that we see men and women coming for. We're definitely seeing, a larger interest in wellness in the men's health space. Men are becoming much more interested in their overall wellness, in longevity, in biohacking, in nutrition. Um, we saw that growing trend more in women, 5, 10 years ago, and that continues to persist, but that's become much larger within the men's health space, which is really interesting and actually really exciting. My practice is primarily women. That might be, on large part because I am female. So, women, are attracted to make feel more comfortable seeing a female physician. Um, but overall, men, historically have not sought healthcare until there's an acute issue, until they have possibly the flu or COVID or a sinus infection or want STD testing. Now, men are coming in more just for a general wellness check to ask questions about a supplement, about a diet they're interested in. So that's definitely a growing trend I've noticed over the past few years.
Yeah, that's really interesting. I was going to ask how that disposition differs between men and women and kind of how they utilize healthcare. I think I saw a stat. It might have been through the NIH. It's something like 40% of men don't even have a primary care physician, or don't, haven't sought out just a regular physical, and like, they wait like 2 to 3 years apart before doing it, sometimes longer. And I think, that's kind of what you said. Like historically, men have less probably of an interest in general wellness, or preventative wellness, if you want to call it that. But that seems, yeah, to be changing. I'm sure maybe that breaks along lines of like a younger demographic, but maybe I'm wrong. I think there's probably a lot more older people who are getting interested in preventative wellness and longevity, as you said, because that conversation has become a lot more democratized, I guess, for better or worse. There's a lot of information out there about quote unquote longevity, and I know people like to define those in different ways, but I think a good, maybe just general definition for people, or a good way of thinking about it for people is just kind of taking a more invested and kind of long term interest in your health, and a preventative interest. I think probably goes a long way for a lot of people, and I think that probably, I guess, speaks to what you're seeing more.
Yeah, men are becoming much more proactive about their health. I would definitely, I hate to generalize, but definitely the millennial and Gen Z population. I think, in large part to the overall interest in wellness in those generations, but also social media has played a very large part in sort of disseminating that information. And health tech companies have offered more and more interesting and innovative ways to access healthcare, and learn, and educate yourself about, wellness trends and diets and exercise routines. So there's a lot more information out there than ever before, and the younger generations are consuming it. Men in their 40s, 50s, 60s might not be consuming maybe as much social media, but they start to, get that awareness of their health and wellness more because, things begin to break down and
Hmm.
now they're having other issues. They're coming now for more cancer screenings. As I mentioned, those obviously increase as we get older. So, that sort of has already been a consistent pattern, but you see the younger generation definitely starting to follow suit and be more interested in longevity, specifically longevity. And longevity, in its core is really just a general idea and pursuit of living a healthier, happier life and a fuller life, and extending your lifespan by, sometimes really basic measures, eating certain diets, preventing, certain illnesses, exercising optimally, building muscle. There's a lot of really basic principles within longevity that don't need to make it necessarily so complicated and costly, but can move the needle in your longevity. Women tend to live longer lifespans than men, and maybe men have also woken up to that fact.
Hmm.
And cardiovascular health is definitely one of the largest causes for that younger lifespan. So
Yeah.
there's a
Yeah.
lot to touch upon there. I mean, we could have a whole podcast on that too.
For sure. Yeah, no, I appreciate the way you kind of broke it down into like there's simple things that can be done, and I think people overlook that, especially in the longevity conversation. Like, so my background also for other people listening was nutrition in school, and I the way I think about the whole longevity conversation is like for obviously people know it's not. I don't think it's a controversial point to make that America on average is a pretty unhealthy country, obesity, chronic disease, and things like that. Um, and I think for whether it's 70% or 80% of people, just kind of the basic things like moving more, eating less processed foods, getting better sleep, lowering stress would do a lot of good in terms of longevity. And then you have the other kind of like 15 to 10% of people who are already kind of hitting all those things, and they're more interested in kind of the more niche optimization type things. And I think all of that gets bundled under longevity, but I think it should actually be kind of two separate conversations where one of them is just kind of these big simpler things. As hard as those behaviors are to change for people, there's still kind of these big umbrella things that people can work on. And then for a much smaller percentage of the population, it ends up being, okay, I'm going to try to become the next Brian Johnson or something. And that's, if that's you, that's great. You can, I'm sure you know what your options are, and what you're doing. But yeah, I think that's a good way to look at it, and a way more people should.
Yeah, definitely. So, Within longevity, I think there's a lot of things that might not be accessible to the masses at this point, but there's also a lot of other options in terms of small modifications we can make to diet,
Hmm.
exercise, sleep, stress. So those can add years to your life as well.
Yeah.
Probably the most, more so than necessarily, having your VO2 max checks, having everyone do a full body MRI. We get a
Hmm.
little too complicated having everyone on rapamycin. There's a lot of interesting new um, tools and assessments, but those don't necessarily move the needle overall in like the population as a whole's longevity.
Right. Speaking of accessibility, something I wanted to ask you about was, obviously in America, we too also have a different healthcare system than the rest of the world in a lot of ways. And I wanted to get your kind of opinion and point of view on just kind of like the different accessibility points of healthcare and what those kind of offer. Because everyone knows about, you've got your kind of walk-in clinics and emergency rooms and things like that, and then of course there's employer sponsored insurance or Medicare, Medicaid, and kind of what that gets you in terms of outside clinics or specialists. And then, as you were saying, like health techs have made things, created more options for people in terms of their health. There's like, a lot more concierge medicine nowadays. There's things like Parsley Health is the one that always comes to mind. It's they, sit with you for an hour and you all this blood work and stuff. And it's expensive, especially I think insurance covers some of it, but there are a lot more higher end expensive options for people who have the means to do that. But so I was just wondering kind of how you see kind of the healthcare care landscape and who these different things serve, and kind of what health tech is making possible and maybe what it's making not possible for some people. Because there's just so many options now, it's kind of hard to navigate.
Yeah. So, I guess you could break it down in a more like bird's eye view. What ways do we access care? So, now in the 21st century, we have virtual care only. Then we have primary care. And maybe there's some models that are now delivering a hybrid model of virtual and brick and mortar clinics. Then we go to, those urgent cares, walk-in clinics. Then we go, if there's more severe symptomatology, we're at an ER. Maybe if we're very sick, the ER admits us, so we go to the hospital floors. And then if we're very, very sick, the ICU is pretty much the last step. So those are sort of the tiers in how we access care. So it's really, outpatient medicine and inpatient medicine. That's another way of sort of putting them into two simpler buckets. Um, with outpatient medicine, I wouldn't say there's so much expansion with inpatient medicine. The hospital system hasn't changed or innovated so much the way outpatient medicine has. Hospitals are still brick and mortar facilities. They're still sort of run like most of corporate America. They have boards, they have CEOs, CMOs. So they're definitely more traditional in a sense. They take insurance typically, maybe not every insurance, but most insurances, most hospitals accept Medicare and Medicaid. Some hospitals don't always accept Medicaid. But that's sort of how inpatient medicine has been developed and administrative and continues to do so. Hospitals are, open to new electronic medical record systems, pain point processes, new health tech apps that might help facilitate hospital patients or patients that are discharged from the hospital, but there's not been as much, change, I would say. With outpatient medicine, and the development of health tech, and a lot of new innovative practices, virtual care has really been, especially after COVID or during COVID, we saw, a huge shift in how everyone, children, teenagers, adults, young adults, old adults, geriatrics, have started accessing healthcare. I, in my virtual practice, was seeing patients in their 60s, 70s, 80s doing virtual visits. They had learned to adapt to the technology and they were even interested in having some of their medical care handled virtually. and would figure it out if they needed to. Health tech companies overall mostly have been able to provide greater access to patients from, all over the US, especially patients in rural areas or areas where there might be somewhat of a healthcare desert. It's been incredibly helpful to have greater access to providers virtually. Um, Virtual care can't always replace in-person care, but it can do a lot of the work. Health tech and direct to consumer practices have been able to also provide access to providers much easier for patients to get in, to have shorter wait times, also to offer more innovative medical, interventions and treatments that, a hospital, it takes a long time, maybe there's a lot of red tape to change or to offer a new medication or to offer something maybe outside of the normal medical guidelines, to go outside of what is FDA approved for that symptom. So um, that's where sort of health tech comes in and helps to innovate and provide greater access to patients, interested in health and wellness and looking for options to improve, their overall health.
Right. Yeah. No, that makes sense. You have obviously a lot of experience in telehealth, the health tech. I wanted to kind of go into that background a little bit. If anyone looks you up, they can see, you've been involved with KINS, which is physical therapy, and then also advising with Redesign Health, which I would actually love to learn more about. I think Redesign does something very interesting where they're kind of starting up all these different um, health tech companies. So, and then obviously you've been involved with us at Vital Protocol, helping with a host of things and giving us some of your experience there with health tech and telehealth. So, I would just love to kind of hear more about your experience in that space, kind of where you see it going. Anything good, bad? Like, do you think it's ultimately a positive, ultimately a negative? Like, what are some of the maybe the drawbacks of all these kind of companies just springing up out of nowhere? And then what are maybe some of the positives, or what things maybe excite you in that space?
Yeah, sure. So, great question, great loaded question. I've been working as a physician advisor consultant for several years now, within a broad range of health tech companies, touching on a lot of things from PT to travel medicine, working on optimizing the EMR, direct to consumer options. Overall, we find that I find at least that a lot of these companies are just providing better access, better tools, and pushing the needle forward where a hospital system just can't innovate quickly enough. They partner with a lot of health tech companies now to help them get to where they want to be because it takes so long to sort of change and adapt to, the healthcare demands of today and what patients really want. And patients want to see, they want to see their provider today. They want to book yesterday, they want care really quickly. And we need to sort of we need to move to where the patients at. They want more healthcare, they want more support with their wellness journey. So we have to, provide that. Um and really it's an access issue when it comes down to it. you know, Having patients seek care outside of their, normal primary care physician isn't always ideal, of course. Seeing a patient going to an urgent care with the same issue, a UTI several times, and then, the urgent care trying to treat it, but not necessarily figure out the root cause, that's really up to maybe the primary care doctor, but they might not be privy to all those visits, let's say, just as an example. That's where there's sort of breaks in care, and might do the patient a disservice that like not all their care is in a consistent umbrella system. But that issue is, slowly being resolved. A lot of even direct to consumer companies are trying to sync with larger healthcare systems to ensure that they have a bit of the medical background of patients so that, they might be privy to what what was going on with the patient last year so that they're not necessarily just treating over and over and not really helping the patient get to the root cause of their issue that's causing these recurrent, let's say, UTIs or sinus infections. Um, but as a primary care physician at a large academic medical center, I had a month and a half wait list. So can you blame patients for wanting to go seek care in other spaces and
Mhm.
platforms? I really don't. Patients can't wait a month for a UTI. You need to be treated right away. So that's why these urgent cares and these virtual care delivery systems have really helped improve care as well. Um, so I think the consistency in care might be a bit of an issue, but I think there's a lot of ways of resolving that. And patients also want more innovative care that they won't necessarily be able to get through the traditional healthcare system. What Vital Protocol offers and clomiphene, that wasn't something that, I could even necessarily treat myself, work up myself, or a urologist at, one of our specialty departments would do as well. So, and it's such a great alternative for some people. So to like other treatments like testosterone treatment. So, you know, giving patients more innovative options, more access to those options, and in a safe environment. I mean, I think that's great. That's what everyone wants.
Mhm.
And in the end, if it's good for the patient, that's, what should be the best for, society overall. We shouldn't necessarily shirk away from health tech companies wanting to expand access to care and to innovative solutions to that care.
Right. Yeah, I think that's a great point. I think that's something I probably hadn't even thought about, which is like, if you're a consumer, I mean, because I'm also a consumer of these things, it's like you see companies, doing something, offering some new model of care or offering some new treatment. While that is, an advertisement for their business and a service or product they're offering, it's also, I'm sure, increasing the education and just like literacy of patients as to like what options are out there. So, I mean, I'm sure there's cases of, where you get an ad for, a drug or a service, and maybe patients go and actually ask just their doctor about it or something like that, where maybe they wouldn't have brought that up before. So I think that's also an interesting way to look at it. Of It's kind of expanding education and access. Another question I had, you kind of alluded to it, is like what um what is the appetite or interest for doctors, I guess more traditional, in office, primary care office doctors and healthcare systems to work with these kind of newer, more innovative health tech companies? Because obviously it's I'm sure there's some tension there where, like you said, like these hospital systems, and I know from like working in one, they can be these big, bureaucratic organizations that are slow to move. I remember like it still blows my mind that the EMR in most hospitals looks like it's like Windows 98. Like it's crazy. Um, so like what does that look like? Is there an adoption coming, or is there a lot of adoption from these healthcare systems and a lot of doctors who are in their own clinics to work with these health tech companies, or are some of them closed off to it? What does that relationship look like?
Yeah, I mean, I think there's a little bit of all of those things you touched upon. But a lot of healthcare systems are actually creating their own accelerators or incubators, and even venture funds where they are investing in startups and helping those startups sort of launch and do that in partnership with a hospital system to ensure that really it is a useful product and platform that can be utilized across different healthcare systems. Healthcare systems, they really need health tech companies to help innovate. They really can't do that alone. They don't have the bandwidth. They don't really have that, that they can't really wear that hat. So, I think rather than trying to fight each other, working together is ultimately going to be the way forward. The more and more, health tech companies that are able to sort of um, blend with the healthcare system will do well. Um, so I definitely think there's a lot of interest now in healthcare systems. You'll start to see this more and more. A lot of I mean, at least I know the New York healthcare systems are creating those spaces. Um, it there are so many health tech companies doing so many great things. I don't know exactly how they'll all integrate or, how a primary care doctor can necessarily provide all of that service or referral service. So I think there's still plenty of consumption that'll be done just independently. But maybe with at least acknowledgement and, at least tuning in the primary care physician to a treatment that you might be getting outside and, providing the PCP with some type of integrated um, information that can, sync with their EMR so that they can see at least when they're doing, let's say, a medication reconciliation. When you see a patient, you typically ask them what meds you're on. Are you taking those meds? How have they changed your labs, your blood pressure, your vitals? That at least they're, acknowledging or understanding that they're on another medication that's being treated outside. Especially because PCPs don't necessarily have training in, testosterone therapy and clomiphene, things like that. So that would be ideal, I guess. So I think there is a way forward for both types of systems. We still need healthcare systems. We still need hospitals and ICUs. I don't know how health tech can fully um, change those systems. They are so deeply rooted in, our society, and they're still very, very important. But health tech companies, outpatient companies can help in a lot of other ways. Primary care physicians were meant to reduce hospital visits. I think virtual care can do that as well. Reducing patients seeking urgent care, um, packing an ER, causing more hospital admissions, more ICU admissions. We often saw patients in the hospitals that stopped taking a medication because maybe it ran out or they didn't get enough education about compliance. And that led them to their ER visit, eventually let's say their ICU stay. I mean, that happened all the time. The root cause was really the outpatient care. Something fell through the cracks there. um, so there's a lot of opportunity here to shift even, hospital care. So I think that we'll have to see I mean, direct to consumer companies are still very, very new in comparison to like our traditional healthcare model. We'll really have to see, I think over the next, 10, 20 years where that goes. It'll be, a really interesting play. I'm not able to fully predict the future, but I'll be
Mhm.
interested to see sort of how that works out. But I still think there's a lot of appetite for those other forms of care because people are interested in wellness. And primary care physicians don't necessarily have the time to educate patients on every aspect of their wellness journey and their interest in what diets to do, go break down their plate of food every day. Those are things I would love to do with patients, but in the traditional healthcare model, your follow visits are 15 minutes. So we don't get the opportunity to give you the education you might desire. And that's not out of a PCP's lack of interest or desire to do that. It's really sort of a system based issue, which that also is a totally other podcast I could
Mhm.
talk about for a while. But um, I didn't get to touch upon this as well, but we were talking about concierge models, and there's another model called, DPC, or direct primary care. There are primary care systems that are developing, which, they won't be accessible necessarily to the masses because they are going to be a bit more expensive. They require, monthly or yearly memberships out of pocket, outside of insurance, but those do offer oftentimes higher quality care, more time with your PCP. And in turn, that could be creating a lot of, positive changes in terms of who ends up going to an urgent care, an ER, and eventually a hospital admission. So there's a lot of there's a lot of interest in more private care and stepping outside the insurance-based model for most of your care in general.
Right.
So that'll also be, a growing trend.
Right. Yeah. No, that's an interesting way to look at it of health tech kind of filling in these gaps and friction points with traditional healthcare. Um, okay, Alexander. Well, I think we covered a lot of what we wanted to talk about today. I think we can kind of wrap up here. Is there anywhere people can find you? Anywhere you want people to go? I know you have social media and other work you kind of put out. So if there's anything you kind of want to people want to follow up with you, kind of follow more of what you're doing, where can they find you?
Yeah, I'm on, Instagram and TikTok, Alexandra Kreps MD. I have a very basic website, alexandrakrepsmd.com, and, those are pretty much the best ways to follow me at this time.
Awesome. All right. Well, thank you so much.
Thank you.